Good morning. Welcome to this meeting of the Adults and Health Committee on the 22nd of January 2026. Councillor Wilson has sent his apologies, so as Vice Chair, I will chair today's meeting. The County Council allows filming and photography at these public meetings, so feel free to take pictures and use social media during the meeting. Please, though, can everyone present turn their mobile phones to silent or vibrate? This meeting will be live streamed and a recording of the meeting will be available on the County Council's website. I will briefly adjourn for a comfort break if the meeting lasts more than 2 hours. There is no fire alarm test scheduled for today, so if the alarm sounds, I will adjourn the meeting and we will leave through the side doors and use the fire escape next to the kitchen. The assembly point is in the car park. Item 1 is apologies for absence and declarations of interest. Will the Democratic Services Officers let us know of any apologies?
Thank you, Chair. Apologies have been received from Councillor S. Fisher, Councillor Levine, who is substituted by Councillor Bradnam, Councillor Nethsinger, who is substituted by Councillor Fain, Councillor Sidlow, and Councillor Wilson, who is substituted by Councillor Damari Homan.
Thank you. Does any member wish to declare any disclosable pecuniary interest or non-statutory disclosable interest? Thank you. Item 2 is the minutes of the meeting of the 9th of December and the minutes action log, which are on the pages 5 to 18 of the published document pack. We are being asked to approve the minutes as an accurate record. If anyone objects, can you indicate now, please? Thank you. Next is the minutes action log. Are there any questions on the action log, or can we take this as noted? Thank you. Item 3 is petitions and public questions. None have been received this month. So we move to item 4. The 2026-2029 draft business plan and budget, which can be found on pages 19 to 58 of the agenda pack. Patrick Warren Hicks, the Executive Director for Adults, Health and Commissioning, will introduce the report. He is joined by Michael Hudson, the Executive Director of Finance and Resources, and Sally Cartwright, the Director of Public Health. We're also joined by other members of the Adults, Health and Commissioning leadership team, together with Justin Hartley, Strategic Finance Business Partner. Patrick, please.
Thank you, Chair. Good morning, members. The purpose of today's item is for the committee to scrutinise the Adults, Health and Commissioning elements of the 26 to 29 business plan and budget. As with other committees, today is an opportunity for members to seek clarification, request assurance and make recommendations that will feed into the Strategy and Resource and Performance Committee on the 29th of January, prior to the final proposals going to full council on the 10th of February. This committee is scrutinising the draft budget as put forward by Strategy and Resource and Performance Committee in December 2025. The detailed financial tables members will be considering within this item are from the December report. I would ask committee members to note that tables have subsequently been updated for January SRMP to reflect the provisional local government financial settlement received in December 2025. And the feedback from this committee could lead to further changes being proposed and agreed at SRP in January. However, due to the timing of papers and publication dates, any feedback from this committee will not impact the January tables, but be considered as part of the SRP finalisation of its recommended budget for full council in February. There will be a note submitted after this meeting for SRMP to consider recommendations and comments made at this meeting. We have officers from across the Directorate and Council with us today to support the committee's questions, and we will capture all points raised. The revised strategic framework is still in development and will be presented to SRMP on the 29th of January. It sets out the vision of a healthy, fair and sustainable Cambridgeshire alongside 3 ambitions and supporting priorities. For this committee, I want to emphasise that the ambitions relating to enabling full, healthy lives and ensuring fairness and opportunity strongly inform the Directorate's work, are set out both in the Adults, Health and Commissioning Strategy, which was agreed at this committee, and the Public Health Strategic Plan, which was also agreed at this committee, which underpins the proposals you will see, particularly in Section 3 of this report. The corporate financial settlement remains challenging, with a forecast overspend in the current year, reflecting demand pressures and some challenging savings targets from previous years. The provisional local government finance settlement announced in December has improved the position somewhat, with a route now to a balanced budget to be presented to SRMP committee later this month. But the final settlement may change and is still subject to finalisation of the tax base. Every directorate, including ours, has been required to identify savings and recalibrate services to maintain financial sustainability and deliver on the ambitions of the Council and its strategic framework to achieve our business plan. I'd like to draw committee's attention particularly to section 3 for the next area of my introduction, which is our headline budget position. So for 26-27, the Directorate proposes a gross budget of 417.4 million, which will be an increase of 37.3 million, reflecting the scale of demand and costs required to sustain the local care and public health system. This includes 14.7 million for adult social care provider inflationary costs, 1.9 million to manage older people's care demands, 4.9 million to meet rising demands within the learning disabilities cohort, and 2.1 million to support mental health demand growth. These investments are critical for maintaining the current eligibility threshold and ensuring the care market remains viable in the face of rising costs and wage pressures. Public health plays a strategic cross-council role in supporting good health across the life course. Commissioned services include the Healthy Child Programme, smoking cessation, weight management, physical activity, health checks, drug and alcohol services and sexual health services. These services are central to delivering the new strategic framework ambition to enable full healthy lives for all, and they directly target some of the inequalities highlighted through the Quality of Life survey. The county continues to experience significant demographic change, with an expected growth of population of 9%, a further forecast growth before 2030 of 6%, and we see a 26% increase in residents over 65 and then a 50% increase in residents over 80. This growth is not just expected in numbers but in the levels of dependency due to multiple need. We're seeing rising complexity across all cohorts: older adults, working age adults with disabilities, learning disabilities, autism and mental health. Compounding this are cost drivers to meet the care and support needs of people and those who provide services, including the funding to support the uplift of the real living wage, increased care costs for learning disabilities, recognising an increase in demand and complexity of need, ongoing impacts from the emergency replacement of the community health contract during 2025, and costs relating to deprivation of liberty and Mental Health Act assessments requiring specific doctors, termed Section 12 doctors. The business plan includes several key priorities, which is around supporting the real living wage to be paid to stabilise the care market, ensuring robust contract negotiation and market shaping, improving transitions for young people as they prepare for adulthood, and investment in preventative and independence building approaches such as individual service funds, extra care housing and supported living. Reviewing care packages and charging to ensure fairness and value, and targeted public health investments in inequality hotspots. These priorities are directly reflected in the financial tables, particularly in the investment, pressures and savings lines, with highlights being nearly 10 million for demography and demand, 8.3 million for cost pressures, 6.66 million additional investments, largely associated with the supporting the real living wage increases. And then we've got £14.07 million of savings through improved contracting, structural efficiencies, rebaseline inflations, and targeted reviews of packages for people with a learning disability. We also have a capital programme includes 6.7 million in 26-27 and 56.6 million over the 10-year horizon. Schemes including Disabled Facilities Grant and the capitalisation of community equipment cost are included in there. Some existing accommodation schemes are being removed pending further work to scope future optioned, and it is expected these will form parts of committee reports in the coming financial year. Chair and Committee, the proposals in Section 3 represent a balanced response to demographic pressures, system challenges and the Council's ambitions for a healthier and fair Cambridgeshire. Today I would ask members to scrutinise the proposals, seek clarification, identify any issues or recommendations you would wish to forward to the Strategy and Resource and Performance Committee later this month. As I say, I'm joined by Michael and colleagues from the Directorate and we're available to support with any questions. Thank you, Chair.
Thank you, Patrick. Questions, comments, members? Councillor Herwith, thank you.
Just a point of order. Are we going to split this up in any way? Because to avoid, I've got a very long list of questions, but I certainly don't want to do them all in one bunch. Are you going to divide it up in any way so that we can ask questions around specific sections?
Right, hang on. Just bear with me while I come back to the beginning of 3.1. Here we are. Right. As you said, Patrick, the budget that you've, or the funding that you've planned for at 3.1 includes £14.7 million of funding for local care providers to meet and pay inflationary impacts. And my the simple question there is, are you confident that £4.7 million of funding will be sufficient to cover the costs, bearing in mind that there's also a need to encourage young people from within the UK to move into care work, as opposed to engaging people who are not UK to come into the country to do it? So that's the simple question. Are you confident that 14.7 million is going to be enough? And elsewhere, hang on if I can find the other question I asked, in the table 3.2, which is on page 30, it's a recognition of the national living wage, which will rise. And are you taking all of that rise into account? And still, will this be enough, bearing in mind that we know people are having to put up wages? We know that in local private sector care homes, people are putting wages over the national living wage in order to attract care workers into the caring profession, because they value the work that they do and they're prepared to offer more. So I'm just wondering, is that budget amount sufficient? Thank you.
Thank you, Councillor Bradman. Yeah, you can answer that one first, please.
So the work that we've done on our estimations, and Justine and Chris may want to join me at the table just to add some further strength to this response. But I think the work that we've done is that for our estimations, the sufficient funds are within that 14.7 million. I suppose if you were speaking to providers, they may well say that they want more money, but what we've based around there are our forecasts around the particular elements of cost pressures, that be around inflation through a CPI methodology, national insurance costs, or costs associated with wage increases. The paper also has sufficient funding to support payment of the real living wage. And we know from speaking to providers that not only are they wanting to pay a real living wage, they're having to pay that real living wage in order to remain competitive against other sectors of where their workforce would be naturally attracted to, who are already paying wages at that level. So the funding will require negotiation. It will require us to be careful management of the total amount of money, because this isn't just passporting it straight out to providers. But on our estimations, it will be challenging, but we think there is sufficient funds in there to meet those costs.
Yes, please go ahead, Councillor.
Thank you. Just briefly, does it also take into account the reduction in the threshold at which employers pay the national insurance contribution?
So the national insurance change came in 25-26 in this financial year. So there was additional funding put into providers, and that gets carried forward. So effectively, yes, is the answer to that question.
Thank you.
Thank you, Councillor Bradman. Thank you. Councillor Howitt.
Thank you. So I'll take my questions in order through the report. First of all, on the ambition priorities on page 20, I don't like the words reduces the need for more intensive support and care where possible, because it's a negative and it's introducing an incentive for a negative. We all know there's no real disagreement around this table that we want more prevention. That's completely fine. But I just don't like the negative. I'd much more like a positive, something like maximise independence in that. So that's my comment there. On section 2.6, for the whole budget in this year, one of the objectives, we're told, is to develop in-house capabilities. Could the officers say where we're developing in-house capabilities in Adults and Health Committee's remit? On public health, in section 3.2, everything in there is stuff we already do. Is there really no change at all being planned or development being planned in public health this year? And the value of the council, the Aspire value, is to be innovative. Where are we being innovative in public health? Because I just can't see that in the report. Can I also ask, are there any additional substitutions this year in use of the public health grant? And if so, what are they and how much are they for? And if then there are not, because it looks like it's 200,000 from the papers, but 500,000 next year, why is it planned to increase so much next year? And what is it anticipated that money will be used for?
Councillor Howard, should we park it there and we can answer those questions, those four questions first, and then we can move on.
Thank you.
Okay, I will answer. I'm not sure there's a response from the first one. Your first point is an observation of the strategic framework, which will go to SRMP, so they will be picked up there, Councillor Howitt. In terms of developing in-house capabilities, we've certainly done a big piece of work within our in-house provider services to look at making them more effective and more efficient. Amy's been doing a piece of work to review structures and to make sure that they're as efficient as they can be. We're also looking as part of the in-house review around reablement services to make sure they are as effective and efficient as they can be. Do the Pathway 1 work redesign that we're doing with the NHS and the acute trusts. So that's why we've done work within our in-house capabilities. We're certainly looking at other opportunities, but as of yet, there haven't been those opportunities to do further development of an in-house model. So that's our in-house work. And we're going to look to Sally for the public health response.
Thank you. Colleagues are hopefully aware that within the public health grant, there is a large proportion of statutory requirements, largely some of our statutory service provision and our contracts that we need to commission on an annual basis. And last year, as you will remember from various committee meeting papers, we've just reprocured most of those big statutory contracts, and a huge proportion of the public health grant in total goes to those contracts. So those are the drug and alcohol service, the health visiting, so the Healthy Child Programme, health visiting school nursing, the NHS health checks, and the sexual health contracts. And then in addition, we also have what we call the behaviour change service, currently is shorthand. But so that contract is also just been reprocured and is in the process of being mobilised. So those all encompass a large proportion of the public health grant, and they do for public health teams across the country. And then what we have left over is what we can then think about. And then also, obviously, there's the staffing and any uplifts on provider contracts that we need to have. And then what's left over is what we can do other things with. So the innovation point, within those contracts, we strive for innovation within what we're doing and the way in which those service providers deliver the services. So looking at different digital options, looking at how we outreach to the populations that really need those services most, how we can maintain people completing their treatments in the drug and alcohol service in innovative ways. So there's innovation within those contracts, but then also what's remaining in terms of once we've spent the money on those contracts, we always look to be innovative as well. So we are working with, for example, the ICB around the cardiovascular disease prevention service through work that we've done previously, and we'll be looking at innovative ways to spend anything that we've got remaining within the public health grant. In terms of substitutions, within this year, currently, we have put in some additional substitutions into the carers activity, which is, has lots of public health outcomes and is a high risk group that we would want to be supporting through public health actions. And then we have some additional for this coming year and the following year, as rightly mentioned, that we are intending to support the council budgets through further substitutions that support the public health grant requirements. So we are looking to what that will look like for next year in the process of this coming year. So that 500k that you mentioned, we'll be working that through over the coming year.
Councillor Howick, would you like to continue with the questions, or do you have any replies to what you have heard?
I think with respect to other members, I'll just carry on with my questions. I don't want to, I think the debate could go on too long otherwise. I will just note, though, that I asked what amount of extra substitutions are there, and I didn't get that answer, so I hope in the next round we will. No, next question. First of all, I'd like to welcome the commitment to the real living wage that is there throughout the report, and I'm delighted to the prominence that has been given. So thank you for that, and you have our full support on that. But when we had this report this time last year, we also had the numbers that it was going up, and we haven't got those numbers today. And is it still going up, or is there any danger it's gone slightly down? I think I accept that to get to 100% is very difficult, although ultimately I would like us to get there. But I do think that we should hear those numbers. And I think there's a difference between us putting in a report that we are pursuing the real living wage and the mechanisms we've got to absolutely ensure that the care providers are respecting that and not just taking the money. And that's why tracking the progress in numbers is important. On page 29, 3.6, you know, it's a reasonable list there, but it says that they're introducing a new enablement approach with the mental health social work team. And with the best will in the world, I think that's a bit of an insult to that team. The idea they're not enabling people in their practice at the moment seems to me absurd. So I don't know why that is in there in that form. I'm sure it wasn't the intention of the writers, but I think that could be better worded in all truth. On the
Councillor Howick, would you like to have a response on that? We continue with the comment.
On the learning disability pool budget, we've obviously discussed this at the last two committees. We should have open discussions about this. I'm not critical of the administration on it. We were all there at the time. But I actually read on page 31, undeliverable savings. So is what this budget's telling us that we're not going to save money in the way that we were told consistently we would do? Is that what's being said in this budget? Or as we were told in the committee meeting last time around, that it is subject to the individual reviews and we're going to see the outcome of those? And I just make the point that that's nearly £9 million that we're talking about here. So I think that there's a very serious question to be answered there. On the reserves, page 29, so I think I've understood it correctly that 836,000 is being taken from the reserves, but what we haven't been given is the overall position of any adult social care or public health reserve, what's being taken against what's being left, and the justification for that. So I would like to hear that, please. You'll be pleased to know I've only got one more, which is, it is a very, very small capital programme for this committee vis-a-vis other committees, including children's and young people's. And I don't know that we're being ambitious enough, in truth. And I would like to see that revisited. I'm deeply, deeply sad of what is said both in the report by the Executive Director already about just dropping the housing commitment. Most of this capital budget is the disability living grants, which are, you know, it's the districts that actually do all the hard work on that. So I think we are doing so little in terms of the capital programme. And we on specialist housing all around this county, and certainly in my division, you've got elderly people who can't stay at home, but don't need enhanced care, but do need more accessible housing. And this council is giving up on providing that or contributing to providing that specialist housing. And I think that's really poor. And 5 years ago, at the start of the previous administration, we were told there would be one new scheme a year being brought in a rolling basis. And in this meeting a year ago, the then head of commissioning told us that we would spend 3 million and we would, through partnerships and innovative approaches, fine, but that we would actually develop housing for accessible and specialist housing for people who need it. And I remember asking, saying, can you spend it? And, you know, there was a degree of risk to that, but the answer was yes. But not only has that not been spent, we're now just even dropping the ambition to do it. And it's just wrong. And so I do appeal to the administration on that, to relook at that and to see if we can still be active in the field of specialist housing. Those are my questions.
Thank you very much, Councillor Howitt. Patrick.
Okay, thank you. So I'm going to ask colleagues to help with the response to some of those questions. So Justine will pick up on the substitutions point. Chris might want to make some comments on the capital position and around the ambitions that we have, and then I'll bring Akua in around the enablement for mental health.
Thank you, Patrick. So in terms of the substitution in 26-27, you're correct, Councillor Howard, it is 200,000. Some of that goes to obviously a lot of the work that's done in other directorates on behalf of public health effectively is based on staffing costs, so they get inflated every year anyway. So there's not a lot of new investment in there, but there is some going into the community navigators section within adults. The other point I wanted to make in terms of the public health grant is at the time that these papers were produced, we didn't have the public health grant for 26-27. It was only just announced just after the local government finance settlement. And so you're not seeing in these papers at this stage that public health grant uplift. It will be in the papers that go to SRP later in the month, because now we know what that amount of money is. So obviously in terms of what you can put that to, you can't make those decisions until you know what you've got. And so that is a piece of work, and that's kind of what Sally was referring to in terms of we're going to work through what we can do with the additional money. So yes, I hope that answers the question.
Thanks, Justine. Chris?
Thanks very much, and good morning, everybody. There's probably two things I'd like to come on, if that's okay, Chair, because there was also the question around the real living wage that was asked as well, and how we ensure that providers are paying it. So I think if I start with that one, there's a couple of mechanisms that are available to ensure for us to ensure that when we are committing commendably to the real living wage and to providers paying the real living wage, that we ensure that they do. So one of those is through our contractual positions that we hold with providers that mandate them to do that. And it takes a while to change those, because we'll have contractual contracts that are in place already that we can't necessarily vary to force that to happen. But what we are very clear about, and we've seen it, is as contracts are being renegotiated, when they come up to be relet, it becomes conditional within the contract, and that gives us quite a powerful lever to pull to ensure that providers are passing it on in the way that we would hope that they do. The other is through, and just to be clear, a number of those mechanisms are already in place, but it takes a while for contracts that have very long terms to them to turn over. The other way is through effective provider contract management. We work very closely with our provider market. We are monitoring them very closely. And one of the things that we are looking at constantly is, amongst a whole raft of things, is what they are paying their staff. And we are seeing really good progress in that. I think this may have been the figure that was cited. Apologies if it wasn't. But we know that over 94% of our providers do pay the real living wage to their staff in the county, which is high in terms of comparative benchmark position. I think it was noted in the question, our ambition would always want to be that is 100%. And of course, that's what we would aspire to. And I think the contract monitoring component that is feeding into and is what gives way to the fact that we have a very high proportion of providers paying the real living wage is clearly having that impact there. And then that kind of fallback position of ensuring that we've got contractual mandates in place with all of our providers is the secondary piece. We would, of course, never want to have to fall back on a contractual position to ensure that a provider is paying the real living wage to its staff as we are requiring. It is always a position of last resort that we would evoke any contractual clauses. So my preference would always be that we're doing that through good provider management and good relationship management, and where providers are struggling financially to be able to pass that on, to provide the support that we should be providing to our partners out there in the care market to help them to be able to do so. So very much continuous work in progress from a really good baseline position at the moment, which is a real reflection of the work that commissioners and contract managers have been doing to get to the point that we're in. But 94.2% is not 100%. So that 5.8% remains the target to close as we go through. And it's something we look at extremely closely and will continue to do so. On the question about capital investment, I think, and I note, Councillor Howett, the comment you made about my previous commissioning director sitting here giving assurances, and I'm certainly not going to do that without absolute certainty. I think where we are at this year, we know that there is a strong case for capital investment to be made in certain numbers of our care sector, where we know that we can make a real difference in things such as supported accommodation, for example, but there are more. What we are clear about, and certainly what I am clear about, is the commitment of capital expenditure has got to be rooted in a sound plan that is properly scoped and realistically feasible in terms of not only its deliverability for outcomes for our residents that may be making use of those services, but also the return on investment that it's likely to bring to the council. The capital commitment that we've made this year that's outlined in the plan is to deliver that piece of work and to put in place to get the scoping and the feasibility studies completed. These things are complex, and I'm not saying that by way of an excuse. They are naturally complex. There's a lot of moving parts to these pieces of work when it comes to developing new provision and the pumping in of significant capital investment. And we want to be absolutely sure that that's right. I wouldn't want the committee to misunderstand what I've just said as an attempt to kick that into the long grass. Those feasibility studies, we have procured the partners to deliver those feasibility studies for us already, and they will commence imminently, and that will give way to a set of proposals that I'm intending to bring back to committee later in the next municipal year over the summer, that sets out our plans, our ambitious plans for capital development, for the investment of capital funding where agreed over the course of the subsequent 1, 2, 3, 4 years, depending on the size of the programme that we determine to get to. So very much for me, I'm in that phase of discovery and feasibility. We know where we want to look, we know where the need is, and we know what we think we might like to do in terms of meeting that need through the good use and judicious use of capital funding. But we want to be absolutely sure that we've got a sound plan that we can all stand behind, covering the aspects that I've just gone through, which I won't repeat again. I hope that covers both of those questions satisfactorily. Thank you.
Thanks, Chris. Akua, did you want to do the mental health enablement? And then if I go back to Justine to answer the reserves question, Richard, which was.
Yeah, thank you, Patrick. Good morning, members. Just wanted to clarify the point raised by Councillor Howett on mental health reablement. So can you not hear me? Sorry. It's not karaoke night, sorry. Is that better? Okay, brilliant. So just wanted to pick up on the point about mental health reablement. So this isn't about how the mental health of people that we support through the reablement pathway is considered, but it's actually a specific pathway focused on people who are being discharged from mental health hospitals. And historically, a lot of the reablement work has been focused on people being discharged from acute hospitals. And not many local authorities actually offer a mental health reablement pathway as well. So this is something that's really positive that we're doing in Cambridgeshire. So in the same way, we'd offer support around medicine management, provision of aids, confidence building for people who are being discharged from physical health hospitals. This offer is now available for people who are being discharged from mental health hospitals, which addresses some of the health inequalities that we have in the county as well, and the inequalities in social care, where the focus on mental health isn't always as equitable as it is with physical care as well. So I just wanted to provide some reassurance around that.
Okay, so on the question on reserves, so the current balance in adults risk reserves is about 4.3 million. Some of that is already committed to similar investor save schemes that we put through the business plan in 2024-25. If you take out the proposals that are in here, that leaves that risk reserve at about 3 million. But worth saying that risk reserve was created some years ago now to cover off any position where demand was rising above the levels that we've got in the budget. So given that we are in an overspend position this year, we have to have further thoughts about what happens with that reserve balance going forwards. But at the moment, in terms of the numbers that are in these papers here, there will be about 3 million left over after the proposals that are in here. On public health reserves, you'll be very aware, because as a committee, you see the public health reserve proposals repeatedly, and they are the public health reserves position will, like the adults 1B, reported in the quarterly FMRs that come here. But nearly all of our public health reserves are committed. We've got about just short of £200,000 of uncommitted public health reserves at the moment. So, and not a very big forecast underspend in this year to go into that. So they are largely committed in line with what committees, what you've seen and what SRP have approved in the past. But there's not a lot of public health reserves left uncommitted at the current time.
Please, Councillor Cavill, yes.
Firstly, can I thank and welcome what was said about the real living wage? And my memory is it was 91% this time last year, so 94% is the sort of gradual improvement one would hope for. So thank you for sharing that. I also was really impressed by what was just said about the mental health team. I think the report doesn't do justice to it, and obviously it can't be over long, and so it was just put in, but I didn't read that into it at all. And I think if this is forwarded to other committees and going down, I think you could usefully just redraft that to say what you just said in the answer, and that sounded very impressive. On the substitutions, I asked what were the additional ones and how much, and I've still not heard it. I've heard from Sally that it's something carers activity, and I've heard community navigators. Can I have actually what it is and the amounts? On the reserves, I asked not just for the amount, but for the justification. Is the 3 million left about right, and why? Should we be seeking to push it up? Could we be seeking to reduce it? That was in my question. And this is an observation on housing. The problem is we've been told that for 6 years that there's going to be a plan, it's going to happen. And that takes away the credibility. No disrespect at all to what's been said. I'm sure it's said with sincerity. But when one has sat here listening to that same story year after year for 6 years, it's worrying, is all I can say.
Thank you, Councillor Howitt. Justine, would you like to tackle the Patrick? Yes, please.
So, thank you, Chair. I'll ask Michael to respond on the reserves point, and then I'll have a view about whether it's enough, and then I'll come back on the other points. Councillor Howitt.
Thank you. I'm mindful, Patrick, also of your comments on this in terms of the position for myself as Section 151 officer is that there was a report uploaded to the SRMP committee papers for next week in relation to my overall comments on reserves. I've not drawn any particular attention to the adults reserve in its sole right. I have identified that reserves are deemed robust. I have flagged that demand in certain areas as well as cost remains a risk in the care service areas, and that we've got limited contingency within the overall budget programme, and therefore we need to continue to consider the adult reserves, noting that children's reserves have now been extinguished in the directorate sense. But at this stage, both in terms of the council's pressure, but also in terms of balancing the risk, I've not deemed that the current projected level is insufficient. But as I say, we'll continue to review that, and that's where Patrick might want to lead in terms of his view in terms of risks that are coming down the line.
Thanks, Michael. So on the reserves, does it need to go up? Not at this stage, it doesn't. Is it sufficient? It's sufficient to provide a level of assurance around some of the changes that we can see. And we know from this year's budget alone, the volatility of certain areas of spend, which we may need additional funds for. So, for example, the risk that we hadn't foreseen with a community equipment provider needed us to call upon the reserves. And having that there gives us a sense, gives me, and hopefully Michael, a sense of comfort that there are some additional funds there when we can't manage within the annual budget that we've been set because of almost outside of our control. And that's very true around some of the other factors that affect either care providers going out of business or individuals needing some adjustments or some investments. Now, we've got a fairly stable care market at the moment, which is why this reserve has continued to be at this level for some time. But that doesn't mean to say that we would want our risk levels to drop, so we have a much lower amount, because that's not been the case, because we naturally are always in a case where we may well call upon those reserves, and I think it's prudent to have that levels of reserve that we've currently got. Having said that, we've got in year, and I'll come on to the LD point in a minute, we've got an overspend within the Adults Health and Commissioning budget, and we've had that all year, predominantly around the spend within the learning disability and the decoupling of the partnership. Now, we might want to use some of the reserves to manage that overspend in year, but once that money's gone, it's gone. So we need to be very cautious and really drive as much of our efficiencies and our work on the current spend within the revenue budget as much as we can before we then refer to the reserves, which is why we've not introduced anything from the reserves other than a small amount which we've put in as a contingency for community equipment. We've not put any of that forward in terms of our current forecast spend, but now we're into Q4, it may well be that we will introduce that as part of our future FMR papers that we both provide here and through into SRMP. On the LD position, the proposals within the paper are that in year, the savings that we'd anticipated in year from the result of the decoupling will not be achieved, which is why we're in an overspend situation as an Adults Health and Commissioning Directorate. The work that continues, and Amy can talk in great detail about the work that continues around working closely with our ICB partners. We've still got a number of cases that are in dispute. We're doing reviews of particular packages. We're looking at other cases which are sitting outside of the pool, but outside of the county, which have been placements into other parts of the country. We're working on those cases, and we're also looking at our own practice within our existing cohort of people that we support to try and drive down some of those spend costs, or at least apportion those spend costs with our ICB partners where we feel there's a health cost, and at the moment social care is bearing all of the cost. So that we do anticipate that number will reduce. Whether it will reduce to be at a break-even position, it won't do that this year. Whether it will reduce to a break-even position in future years is still difficult to say. I think it's a challenge to get there, and that's different to the information that we based our decision on around the decoupling from many years ago. So that's that one. I think on the capital position, I think Chris gave a really helpful set out what our plans are. And yes, you are right, there has been promises made. I think the reality is that the resources required in order to do the robust business cases that are needed were never there. And there were assumptions that we could just spend the capital money. And I think at a time we probably could, but we know that the costs of capitals increase significantly, putting not only the adults plans at risk, but also some of the major plans that we'd got within as a council. So we've had to do a full review of our capital programme as a council. We've had to do a review of our capital programme as a directorate, but that hasn't meant to say that we've taken off our ambitions. It's just that we're trying to now bring papers back. And I think with the resources that we've managed to procure, we will bring back more robust business cases that can evidence to both the capital programme route and to committee that we've got plans in place to introduce new programmes on the back of the funding that has always been sitting within the adult health capital programme, but never been spent appropriately. And then on the substitutions, I think we've covered that. I think what we suggest to committee is we take that away, we look at it. If it's important to go into SRMP, we will do. We've reported, I think, through our budget setting process throughout the year to committee on when we've spent, when there has been movements and adjustments within the public health reserve, which has been to contribute to help towards the overall council's bottom line position in year. So there has been monies used from the public health reserve to help around that, but it's been targeted at areas that comply with the public health grant but are spent within other areas of the directorate. So we will take that away, because we're clearly not giving the answers. We're not giving the detailed answer that's been looked for. So we will take that as an action.
Councillor Howard, yeah.
Just on that, I hear that answer. So is there a commitment that I'll be written to with that information?
We will take that as an action, yeah.
Yes, thank you.
Councillor Bradnam.
Just a quick one. Thank you, Chair. And it picks up on a point that Councillor Howitt made. Going back to the disabled facilities grant, I'm looking at page 54 in the detailed tables. Now, bear in mind, we've had briefings from the Integrated Care Board saying that they are having to adopt a totally different way of working. And one of those three things was moving, you remember it was analog to digital, but one of them was hospital to home. And so there's a complete drive within the health service to try and get people being cared for long-term in their homes rather than in hospital. So picking up on the point that Councillor Howitt made, what I wanted to know is that budget, which is Disabled Facilities Grant, and indeed the Integrated Community Equipment Service, but certainly on the Facilities Grant, nearly 63 million over the years. Does that represent a bigger investment compared to previous years? Or is that the same or less than in previous years? Because if we're going to support this move into supporting people at home, we are going to need housing that actually is adapted and suitable for people to actually be looked after in their own homes or in a suitable home. And I'll add to that, from my own experience, we have a brilliant community care warden, which unusually in my own village, we pay for ourselves with some extra grant funding. But that person going into people's homes to support them in their own homes enables them absolutely to continue living safely and happily in their own homes and not going into hospital until they absolutely need it. So this kind of funding is really important. So does it represent more than we have invested in this in previous years?
Thank you, Councillor Bradnam. And I'm very impressed that your community has a community home coordinator. That's something I may look into. It's
Community care warden. I'll tell you about it afterwards.
Amazing. Justin, would you like to come back on that, please?
Thank you. So the Disabled Facilities Grant is a rather unusual one. It comes to the County Council, but we don't spend it. We have to passport it all to the district councils. The allocations are set by government. The amounts have increased because the government put more into Disabled Facilities Grant in recent years. But it goes because the district councils have the housing responsibility, they have the Disabled Facilities Grant. So yes, that does, sometimes that causes us some issues because the sort of cost of housing works are going up and up, and the Disabled Facilities Grant maximum level is often not enough. And some of our districts are actually, Huntingdonshire has the most, but it also has the most demand, and it's actually quite difficult to to cover that off. So sometimes we've had to put money, particularly on the children's side, where it's about keeping people out of really expensive placements. Our council finds ourselves having to sort of step into that position, but generally DFG is not ours to touch, even though it comes through our books. So it's quite an unusual circumstance that we're dealing with.
Thank you, Chair. That kind of reflects my recognition, but I thought we had some control over that grant. But if we don't have control over it, that makes sense. Regretfully. Okay. Thank you.
Thank you.
I
Any
was
other
going to add,
comments?
though, if that's okay, Chair, that we will have control over it in the new authorities, of course, because when you come together under local government reform, it will be a different position. So it's just a sort of short term where we don't.
Thank you, Justine. Yes, Councillor King, please.
Thank you, Chair. As a relatively new member, obviously to the council and on this committee, and I don't have obviously the institutional memory that some of my more esteemed colleagues might have. I mean, I'm very supportive of the direction of this committee, and obviously what we're trying to do now, adult health and social. But someone once said to me, you know, you can have ambitions and you can have the right instincts, but if you don't have the ability to deliver them, they're just that, they're just wishes. So I think the things that I'm really trying to get my head around is stuff like the savings and the efficiencies that were within this budget. So there's I think, as Councillor Howitt said, there's 14 million that's predicted. Can I get some examples of previous ways in which we've done better but done it more efficiently? That would be kind of really useful for me. Some examples from previous years where we said we're going to improve this service and we're going to save money doing it. Is there a way to sort of see that? That would be great.
Thank you, Councillor King. Patrick?
I'm just looking down the table to see, because everybody down there is relatively new, so it's probably down to me to answer that one. So I think areas that we've worked on. So one of the in-year savings, which has been a real success, has been around our really close management of contracts. So we establish contracts, we put them in place, but for a lot of our work, we have framework contracts which provide a greater number of providers to come onto contract, but that when you have the more providers, that makes it more of a challenge in order to manage those contracts effectively. So what we've done is we've paid particular focus on the kind of certain contracts where we've done some greater work to make sure that they are delivering what they've said they deliver, they're delivering on their KPIs, they've got the right outturns, and therefore where they're not, we can then take remedial action, which has seen a reduction in the spend that we've got, and we've seen a financial benefit, a cashable saving, as in monies that the council can kind of recover or not spend. So that's one example of where we've done it. I think the other pieces of work that we've worked on are where we've taken a slightly different approach to practice and the way that we work with individuals, and make sure that we focus on a strength-based approach. So working out what the person can do for themselves, rather than maybe historically we've been very much more paternalistic and doing things for people without asking how much they can do for themselves. And therefore, if you work with people and you support people and you use the support networks around them, you can often give them a greater sense of independence, improve their outcomes, and indirectly reduce the overall cost of that. And on individual packages, they're relatively small packages of care. They could be relatively small, but when you cumulatively bring those together for a number of people, you then get some financial returns. So that's another example of where we would do that. I don't have the detail into these bits, into these proposals, but there's some of the examples that we would use.
So can I just, so on the sort of deficiency part, and do you have a level of sort of, you know, confidence on the 14 million? If I had to ask that question, you know, how sure are we? I think again it follows the question of the Quality Assurance Forum. You know, are we actually able to deliver these aspects of this budget?
So I'm not too confident to say fully assured. There are some risks associated with savings, particularly around the deliverability in the timescale. So that the importance is that if this is approved, that some of these get saved, the savings start to come in from the 1st of April. That's why it's important that we get ourselves prepared for it. Some of the proposed efficiencies and savings in the paper are work that's already in train. So we would anticipate we will deliver. So our levels of confidence there are greater. I think what we've done this time, which is maybe a learning from previous years, is we've got a broader portfolio of areas the way we want to make efficiencies and savings. So actually the impact on individual areas of expenditure are smaller than they maybe have been in the past, where we tended to put larger figures against particular pieces of work which have struggled to deliver on savings. So I think that broader portfolio, the work that's already in train and are being ready for the 1st of April, gives us a greater confidence that we will be able to deliver there. There are some, we've rated all of these efficiencies and savings. There are some which are a higher rating towards red than others, purely because of the amount of work that's required. But I think there is also a level of confidence that some others will be delivered and are already starting to deliver in year and will continue to be as they move into a full year into 6-7.
Thank you, Patrick. And there is also the opposite argument of what is it that hasn't worked exactly well, and what are we doing in this term? An example jumps to mind: payments. Justin, maybe you would like to say something about what the problems that we had with payments, and then where we are at the moment, which is kind of a reverse way of what Councillor King said.
Yeah, I mean, what I would say is that the finance monitoring report that comes to this committee is a good place to look for where we're doing with current savings. And obviously those reports going backwards will always have reported all the savings that we have delivered in the past and how efficient, how well we've done on those. You will always have some that don't deliver to what's in the plan, but we also have some that are categorised blue in that savings tracker, which over deliver, and it's about, you know, sort of that balanced position. Patrick, I don't know whether you want to answer on terms of the direct payments and the success of that in terms of delivery of that, but that's what I would just say. It's a balanced position, and it's about in the successful years, we'll never hit everything exactly, but it's about getting the overall position to the right place.
Thanks, Justine. So, yeah, the direct payments has been something that, you know, direct payments and the take-up of direct payments is something that we would want to promote. We would want to encourage people to have a greater choice and be able to manage their own money. I don't think it's been, over the years we've attempted to do it, it hasn't worked well. We've had savings targets against it, which are probably the wrong thing to put against it, because actually it's the wrong driver. What you want to do is embed that as a way of working, and that people understand around the opportunities with direct payments rather than having a financial saving against it. That, you know, our ambitions and the work that we have around individual service funds and growth of direct payments continues to be a major piece of work that we're working on. We're just not seeing the return on that in terms of the numbers growing. And we looked yesterday at our performance, which again continues to be really low compared to other regional and national comparators. So there's lots of learning that we're taking from others. It's just that we'd put savings in there in, I can't remember which exact year, Justine, but many years ago, a savings target was put in there and it wasn't deliverable. And we've continued to report on it as an undelivered saving. So we're hopeful that the savings we've got in this plan are much more deliverable. It's just that we carry some legacy savings from previous years. Chris, did you just want to add on the confidence bit around the delivery of savings? That might be helpful.
By all means, thank you, Patrick. I think it was just, yeah, picking up on the piece about how confident are we in terms of what we've set out. And I think one of the things that hopefully I can add that gives a bit of reassurance here is a substantial amount of the savings that we've set out are related to how we manage provider negotiations and how much money we put into the market and how we kind of strike that really delicate balance between investment and the investment being targeted to where it's needed, and our challenge back to the market to be as efficient as they can be as well. So it's a genuine partnership. The piece where I would kind of echo Patrick's original starting point is there's no such thing as a sure thing, but certainly in my 5 months since I've been here, the work that I have been seeing that is in place and really well embedded in terms of how we are managing those negotiations year on year, and the results, the obvious, tangible and measurable results that are being that are evidenced in our and will be evidenced in previous years' outturns and evidenced in this year's outturns, point to the fact that, certainly from my perspective, there can be a high degree of confidence placed in our ability to deliver those savings, and they are quite a substantial proportion of that 14 or so million pounds that's been set in there. So I think the bit I really wanted to reflect back to committee was the robustness of what I have seen in place that sits underneath our ability to be able to deliver those savings, and it is, in my opinion, very robust indeed. So I just wanted to, I thought that was quite an important point to add. It adds to the how confident can we be conversation without wishing to be overly confident in any way, shape or form, because things can happen and there's a lot of moving parts locally, nationally, legislatively coming up that we know we're going to have to grapple with, all of which have the potential to blow us off course slightly, although none of which at the moment indicate that that will necessarily be the case, might I add. That was all I wanted to add. Thank you, Patrick. Thank you, Chair.
Thank you, Chris. Councillor Black.
Yeah, so on a new issue, if nothing more on this. Yeah. Thank you, Chair. I'd like to thank the officers for getting us to where we are now, and all the hard work that's gone into that. And to note that things could be worse. We could be in a situation where we're being told the budget is difficult to balance, and we've got a whole lot of really unpalatable decisions that we might make and choose which unpleasant decision you want to make. So I was pleased to hear Patrick say that we have reserves which we're thinking of in the case that a care provider goes out of business. We're thinking we could use that. I mean, that's good to hear that we're thinking about what can be done. I'd like to say something a bit more general. It's not really a question. I hope that's okay at this stage, because I feel that we're not there yet. This is not the sort of discussion that I would like to be having under a Labour government. We still have social care in the same crisis, if that's the right word for something that's been going on for a couple of decades, but in the same problems that it has. And I regret the fact that we have not had massive changes and that we are not looking at a roadmap for a national care service and working out how we would be doing that. I regret the fact that things have been pushed away to the Casey report, which doesn't seem like it's going to take ages for this commission to report. And I felt that we had a roadmap from the Unison and Fabian Society papers and many other reports that we've had over the time where things could be going forward smoothly. So what I'd say is this is not the sort of position that we want and hopefully will eventually have from a Labour government. It's not, the stuff has not happened yet. The big changes have not happened. But for all that, I'd like to welcome where we've got and what we're doing. In particular, I'd like to welcome the progress we made on the real living wage. And so we are talking about substantial improvements for care workers, and we're also talking about that we think we can fund that. And I think that's good. I think that is the difference a government can make. And I'm really pleased that where we are, that's where we're going forward. But what I'd like to say is, let's remember that the ambition is to move fairly quickly to where care workers have national negotiations to set floors to their pay and where they might well be pegged to NHS rates, which would be a situation that is better again than what we have here. So I would say I look forward, I hope, for a number of years in the future to get into the situation where we will be celebrating what's happening in social care and the fact that a system that was failing is being fixed. That's not happening today, that is happening in the future, but I'd just like to say, well, you ain't seen nothing yet, but I welcome what we've heard today. Thank you.
Thank you, Councillor Black. Yeah, we may have an opportunity to discuss that in probably a little bit more further detail in item number 6 as well. Councillor Tierney.
Thank you, Chair. I personally don't have any confidence that we'll be able to deliver the efficiencies and savings claimed in the budget proposals. Don't get me wrong, I absolutely wish officers well and I hope to be wrong. But one of the things I've seen over years of being a councillor is when you have a very difficult budget to balance, rather than make cuts that would be very unpopular or take necessary action, one of the things you can do is to suggest these very negligible, vague savings and efficiencies you're going to make for vast amounts of money and balance the budget that way, and then worry about whether you do or don't down the line. I'm not saying that's what's happening here. We'll see, but my confidence is, I think, lower than some of the other people in the room about that. And I just wanted to make that point, get it on record so we can see down the line what happens. Thank you.
Thank you, Councillor Tini. Any more comments? I just would like to thank as well the team. I think Adults Health has managed to gather a young, very strong team. I have confidence, and of course we are testing them every day. But I am well impressed so far by Patrick, Rishan, Akua, Rachel, Amy, Sarah, Justin, Sally, Chris, and I forget to mention more. But so far in my interactions, I am well impressed with their work and their capacity. These are difficult decisions. This is a difficult budget. It hasn't been easy in a context that is by every means very challenging. It's defined by rising needs, increasing complexity that is dragging for years now, and with sustained pressure on adult social care and public health services. Those pressures are not abstract. They are clearly evidenced in the figures that we have seen today, particularly around older people's care, learning disability support, and mental health demands. What we are doing is twofold. First, we are meeting a statutory demand responsibly, ensuring that people who need care and support continue to receive it in a way that is safe, lawful, and compassionate. So the additional funding identified that we heard today, the 14.7 million to healthcare providers to meet ongoing costs, and including inflation and support on the real living wage, the 1.9 million to meet demand for care and support amongst other people, to access both home and residential care, the 4.9 million to help meet rising levels and need amongst people with learning disabilities, and the 2.1 million working for working age and older people with mental health needs. And those are actions that are reflected in this budget. Now, what Councillor Howitt said on the prevention side, on what is it that we are doing, that is the second point that I wanted to make. It is just as importantly, because I think we could also shift the system over time through the public health strategy presented to us previously, and working together with our partners in the Health and Wellbeing Board. I'm personally working very hard to focus on prevention, on early intervention, and on tackling the underlying causes of poor physical and mental health. That work is not quick and is not headline grabbing, but it's essential. And if we are serious about long-term sustainability, both for our communities and for this council, we need to tackle that and tackle it now. So I want to be clear that none of us are taking these decisions lightly. I believe this committee can be confident in general that the approach that we are taking is evidence-led, financially responsible, and rooted in genuine commitment to improving outcomes for residents across Cambridgeshire, particularly in the most deprived areas. Councillor Tini, which you probably understand in your community, are very, very pressing. So thank you for the report. And now, Patrick, we will move to summarize. We have an action already, or we move to the report and recommendations.
Yeah, thank you, Chair. So, and thank you, committee, for the questions and the scrutiny of the business plan budget that we've discussed this morning. I've got certain areas, and with a thanks to Michael and colleagues at the back, around the capturing the checks and challenges around several areas, which I have here is the provision for providers, including supporting the real living wage and the impact that has on the market. the use of the public health ring fence grant and the use of substitutions, the learning disability pool position, the confidence in savings, and the use of capital and budget investment and proposed plans for that going forward. I think officers have provided clarity on that matter, albeit on the substitution. We've agreed that we will send a note on the detail to Councillor Howitt, and we'll make that available to all the committee members. And as a result of the debate, I've got I don't have any issues identified that need to be flagged to SRMP in relation to the budget, although a request was made around ensuring that the ambitions are framed positively, particularly around the mental health enablement. I think Akua provided much greater clarity than was contained in the paper. So I think we might just need to make sure that SRMP are fully understand about that ambition and how that's framed positively. Thank you, Chair.
Thank you, Patrick. We will move now to the report recommendations. The committee is being asked to A, consider and scrutinize the proposals relevant to this committee within the 2026-29 business plan and budget put forward by the Strategy, Resources and Performance Committee on 11th of December 2025. B, recommend changes and/or actions for consideration by the Strategy, Resources and Performance Committee at its meeting on 29th of January 2026 to enable a business plan and budget to be proposed to full council on the 10th of February 2026. And C, to receive the fees and charges schedule for this committee included at Appendix 2. We will now move to a vote on this. Is everybody in agreement? Good. I see unanimous agenda. No? Can we move again to a vote, please? For abstentions? No against? Nobody. Okay. We got that agenda. Thank you. The Democratic Services Office will announce the results.
Thank you, Chair. So there were 11 votes in favour, 2 abstentions, no votes against. So the recommendations are carried.
Thank you very much. Item number 5 is Mental Health Early Intervention and Prevention Tender, which is on pages 59 to 82 of the agenda pack. The report will be introduced by Shona Torrance, the Head of Adult Social Care Commissioning, and Guy Fairbrain, Commissioning Manager for Mental Health.
Morning, can you hear me? Perfect. So, morning committee. The paper today is seeking support from committee to approve the procurement of a redesigned and improved mental health prevention and early intervention service. The service aims to provide both statutory and preventative support to adults with mental health challenges across Cambridgeshire, enabling the council to increase independence and delay the need for more intensive intervention, with examples and outcomes of cost avoidance highlighted in 3.4 of the report. At a national, regional and local level, people presenting with mental health challenges is rising, and the council is working as part of the wider health and social care system to seek to manage this demand and ensure the right services are available in the right place to meet the needs of people in a proactive and preventative manner. This service is delivered by the VCSE and is currently locally known as the Good Life Service, and it sits as part of a wide range of options available to people with mental health challenges across the system. It offers a range of support from specialist one-to-one services through to group activities, peer mentoring and financial support. The current service has supported over 4,500 people over the last 6 years, with a significant rise in the usage of its digital platform and cafe model, reflecting the demand for this level of support. The redesigned and improved service has been informed by a collaborative review undertaken in partnership with public health, commercial, finance and procurement teams within the council. We have also worked with our independent co-production partner, the Sun Network, to ensure the views and feedback of people with lived experience has been accounted for, and the visions and outcomes for the service have been detailed in section 3.7 to 3.10 of the report. Key improvements and changes to the service include a change in the way we commission the one-to-one support hours to increase the flexibility of this service, utilisation and move on to other services as people regain their independence. along with realignment of rates to equivalent or very similar services, which is enabling us to deliver an efficiency of around £200,000 that can be reinvested into mental health provision once a number of reviews have been undertaken and based on evidence of outcomes. There's been a redesign of the group activity and cafe model to ensure better equity and access across the county in support of the council's place-based ambitions. And there's been an introduction of a more robust evaluation and monitoring framework to drive value for money and measure outcomes throughout the lifetime of the contract. This service will also be commissioned separately from Peterborough City Council as part of this procurement. Some of the changes have resulted in an amended annual service budget of just over £943,000, with details of changes being outlined in section 3.14 of the report. Please note we are awaiting confirmation of funding from the Integrated Care Board, which is due imminently. But should this not be confirmed, there is an amended budget of £802,000 that's detailed in the report, and commissioners have worked really closely with services and our review group to ensure that their plan B is in place, so a stable position will be there moving forward. It is proposed that the service is commissioned in line with the Procurement Act, following an open procedure, with the new contract being awarded in September 2026 on a 3+2 year basis. Thank you very much.
Thank you. Any comments? Thank you very much. Lauren.
Thank you, Chair. Sorry, let me move my mic a bit closer. A couple of questions from me. First, I was wondering, could you expand a little bit more on how the financial support element has been delivered so far? I'm noting that it's delivered through the Cambridge Housing Society, and we just appreciate a bit more detail there. And the other comment/question from me is, I note in the previous service, looking at paragraph 3.13 here, there's a acknowledgement of the dual diagnosis/co-occurring conditions section, working with CGL there. I couldn't see any reference to that in the latter part of the report, and I would welcome some clarity on what we're doing there, or if that's being discontinued as part of the new model. Thank you.
Hopefully you can hear me. So expanding on the financial, looking at the financial element, yes, it is delivered in partnership with the current provider and CHS. It's delivered as part of the one-to-one service, so it's eligible to people that are in the statutory element of the service, and it's a personalised service which works on a individual basis, either in person or online, or whatever is appropriate, to work around the individual's financial position and help support them with things like benefit applications, et cetera, et cetera. So we're proposing to continue that, but actually make it broader so that it has a wider access for people within the proposed new service. So hopefully that's answered that element for you. The dual diagnosis element, maybe it's not been fully clear. It continues. So what we know is within the cohort of people that are supported that there is a strong prevalence for drug and alcohol usage, and it's really around, it's intrinsic part of the service. It's really a signposting element. It doesn't deliver the service, but it recognises who it works with, and working in partnership. The current provider is CGL, so working in partnership with that, and in a broader context with other areas as well within the VCSE typically. Yeah.
Thank you very much. Yep. Councillor Bradnam, please.
Thank you very much, Chair. Thank you for the report. Very much appreciated on this section. One observation and a question. So my observation is looking at 3.4.2, page 66 in the report, under the heading preventative impact. I think this is so important because of the question I raised before about the whole drive for the health services to move from hospital to home, prevention instead of cure, or response, as it were. You know, we were trying to catch things early on, and we know early intervention can save a lot of money later on, but also it gives the individuals concerned a much better outcome. So I'm delighted to see that the cafe model has delivered 12 regular in-person cafes, and the fact that it's going around, it's delivering in around the county. And that works out as, 343 average attendances per cafe, which is fantastic over the period of time, which is great. And that is obviously a good model that's working. So well done for doing that, because I appreciate it's not always easy to deliver this kind of intervention, but it absolutely enables care to be provided in communities and in a way that people feel less stigmatized at going to. So good on you for doing that. I really appreciate it. My question, I realize in writing it, it might be possibly directed more to the service itself rather than to our officers, but I'm concerned at the number of young people who are waiting for months, sometimes even years, to access mental health support. And I wondered, perhaps could somebody tell me what we're doing, if anything, to address that, and whether it's in our remit as well? Thank you.
Thank you, Councillor Bradnam.
I can pick up part of that, Councillor Bradnam, but we might have to come back to you on the preventative services available within the children's social care space. So this service is for adults over the age of 18, so it will pick up younger age groups, but not necessarily those that fall within kind of children's education, children's, young people and education. So what I could do is take an action to come back to you with the preventative offer and speak to my colleagues over in those teams outside of that.
Just thinking about it though, we appreciate as an authority, we're responsible for young people up to the age of 25, aren't we? So I'm just wondering whether the 25 fits into this, or is it?
Absolutely.
Does it sit with children or does it sit with adults? But
yeah, absolutely. So this service is available to anyone over the age of 18 that is having any mental health challenges, and that ranges from the kind of low-level prevention end, so that people are helped at the earliest possible stage, as you've mentioned, to manage those needs, but also at the statutory end, where one-to-one more intensive support is required for a temporary period of time to enable people to develop that independence, manage those challenges and move on to a different pathway potentially.
If I may then, let's switch it. What are we doing for adults in this? Is this the one thing that we're doing, or are there lots of other things that we're doing to assist adults? Because this wait for mental health service support is long for everybody.
Yeah, there's a variety of different, which are not included in this because they're fit in other areas, but there is a variety of different services that we are involved with, we support, we contribute to, depending who leads them. Some of them are led by the ICB. And we contribute to those contracts as well. So there is a breadth. Obviously, there are delays for some people accessing health services, and things like the digital. What we've seen is things like the digital offer within this are one way of quite open access and support that's provided. And you probably see from some of the data that's in there, there's a bias towards younger people using that platform. So, and there are platforms that are very similar to that, which are also for people under 18 as well. But yeah, it's just not included within this section. But yes, there is by no means perfect, but there are a number of other different services out there which are there to support. For instance, Lifecraft is one good example, which has the Lifeline service, which we contribute to for people to access in Cambridgeshire. So that's just one example.
It's probably worth noting as well that there are a number of reviews taking place at the moment, and the outcomes of those reviews will be quite critical. So I mentioned the £200,000 efficiency, and the outcomes of those reviews will help us inform how we reinvest that so that it has maximum impact in managing that demand. So there are gaps there. It's not perfect, but we can use the outcomes of those reviews to start to invest in that area as well.
Thank you. Do you know when we are expecting those outcomes, those reviews?
Early, so imminently as well. So one is due in January, and then we're also reviewing our mental health social work section 75. Patrick might have an updated view on that.
No, you're spot on. You're spot on, Shauna. So the PPL work, the review of the community mental health services that the ICB has commissioned, that we've all been involved with as key partners and stakeholders, that's concluded, and their recommendations are extensive, as you can appreciate. But there's working groups now to look at the implementation, the deliverability of that. We're doing our own review of our Section 75 mental health service, which is being led from within Sarah's team. And we anticipate that will, with recommendations, will come into the summer. So again, into 6-7, we will have a clearer steer on those particular points. And then Chris is involved with the commissioners within the ICB at looking at joint roles and joint opportunities for single commissioning for mental health services. It appears to be, as others are much more aligned, at times it can feel so disparate. So there's something about how do we bring it together so there's much more benefits of them joint commissioning around mental health services, both from a preventative or also up to acute end as well.
Thank you very much, Patrick. Councillor Howitt.
First thing I want to say is this is a damn good service. I've seen some of it and associated services with Mr. Fairburn. Very proud of them, and I think it's been great. And so the first thing I want to say is not to criticise what Cambridgeshire County Council is doing, but to be pretty critical that both Peterborough have pulled out. It's their decision, of course, but that does prejudice the service that's there. I think they were giving 9%, we were giving 62%. We've probably been subsidising them anyway over the last years when we shouldn't have been. But from the point of view of the service provider, it prejudices the service model that they've got, that Peterborough are pulling out. And then I hear everything that's been said by the ICB, but the ICB are looking to save money, and I fear that we'll lose money to the service from them as well. And I hear what the executive director says about joint commissioning and so on. I'm all in favour of that, as long as there's a fair deal. And we've just been talking in the learning disability space about our difficulty in ensuring that. But if we can do it and be sure there's a good deal to be done, I am in favour of that. But we should say that the viability of the scheme as it's currently provided is being threatened by what's been done by Peterborough and what potentially could be done by the ICB. What was said about the CPL consultants report is really interesting. I don't know if that's a public document or could be shared with members, but if it could be shared with members if necessary in a confidential way, I would be interested to read it. In the detail of the retender, first of all, I really want to welcome the efforts towards co-production that are described in 3.2.2. I've said before at this committee we should spend more time and put more attention on co-production. I think what is written in that paragraph is really impressive, so well done for doing that, and thank you. If I've got one gripe, it's about the 200,000, and I've got two worries about it. One is, if people are in mental health crisis, then sometimes they're not going to turn up for appointments. That's obvious, isn't it? And so what we're saying is that the cost risk for that is being transferred from us as a local authority to the care provider. And if I was the care provider, whether it's the existing one or a new one, I would question whether that is morally justifiable. And I'd ask Mr. Fairburn, what is the non-attendance rate for the provider, and what's the non-attendance rate for our own in-house mental health social workers? Because if it's the same, I think there is an issue of fairness to the provider by transferring that risk. Now, I know that the officers are trying to save money and have to do so, and so I can see the motivation, but I can't read that and not but think, is this fair to the provider? And then similarly, sorry, I need to go back to my note for a second. Similarly, the point about the 200,000 being reinvested in mental health services, good, fine, but I don't see that on page 71. I see the saving But for reasons we've heard about the reviews, they can't say exactly, the officers can't say exactly how it will be reinvested. That's fine, right? But it really must be. And I just a bit worry when I read what's in the report on that. So if the minute of this meeting could say explicitly it will be redistributed into mental health, I would be really assured by that. And I think it should be. We shouldn't be looking, if you take the quality of life survey, if you take what many of us know in terms of the mental health crisis around us, we shouldn't be taking money away from mental health. So I very much hope that the redistribution promise will be absolutely honoured. But I do support this service. I should say, by the way, Mind, the current provider, have got a very good reputation locally, and we should be thanking and acknowledging them for what they've done. Thank you.
Thank you, Councillor Howard. Yes, Guy, perhaps you want to respond that in if that is being modelled or shown? Yeah.
Yeah, so it's not as never is as clear cut, but it's not as clear cut as just non-attendances or something like that. It is the overall efficiency of the service. I'd have to get the numbers because they're not in my head, but I'm happy to share them. But it's not as wider. It's not just that people are not turning up. It's a wider efficiency issue than that. But I absolutely take on board your point. Yeah.
It's probably worth saying the way we can monitor that is through our key performance information and those regular contract management meetings as well. And so an informed approach can be taken around that balances the risk to the provider and the council. This isn't just about just payment on actuals, it's around realigning the rate so it's the equivalent to our other services and doing it in that way, and increasing the performance around people moving on from the service, regaining independence, and then moving on to stepping them down into other more appropriate services as well. So there's a range of factors in that.
Thank you. Councillor Black.
Thank you, Chair, and I'd like to thank the officers for the report. And yeah, I'm worried when I see a report like this where we're talking about savings and whether what we have is cuts. I mean, I'd rather like to have some reassurances to whether there is stuff in the city's cuts. But I'm also, I suppose my question that I'd like to ask is, where are we with Peterborough and the ICB? I'm a bit disappointed to see that there seems to be a big risk to everything from the ICB. And my question is, in the papers here, I can't really get a handle on the sort of consultation we've had with Mind and how they're going to cope with this. So it looks to me like there is a big challenge to Mind, but that it's not clear what the solution is and how they could cope with these sort of changes. So yeah, I think I would like to sort of comment on that. In some ways, I'm disappointed because it looks a little bit like the same story as for the whole time I've been on adults and health, and probably going back for years, in that we spend an awful lot of money and bureaucracy on commissioning. And I'm looking at this and thinking, well, there's a possibility here that things could get a lot worse. I don't really see much possibility of things getting better. I think we've got our non-profit contractor. There doesn't seem to have been any really serious look at an in-house solution. Again, I'm not sure this is the first place I'd be wanting to see our first in-house things coming from, but yet again, I just don't see this council taking seriously the possibility of in-house solutions. And things could get worse in that I think there is a real possibility that we could get a bid in from a private sector contractor that's looking to make a lot of money from this, and that is possibly looking to shape a loss leader to get in there. And yeah, it does worry me. I mean, I feel that this is partly down, I'm going to blame the government a little bit. I feel they should have tackled the commissioning system, and they should have said, right, things are going to change now. We're not going to be constantly wasting a lot of bureaucracy on commissioning. Stuff that's in-house will stay in-house. We perhaps will not challenge our non-profit providers, but we will switch a whole lot of resources to looking at in-house solutions that squeeze the profit coming out of our social care system and our health system. Because if they're not finding extra money easily from everywhere, then stopping money going out on profit is one way that they could be making a real difference and making things a lot better. So yeah, it does concern me that what we have here today might lead to things getting a lot worse. I can't see the prospect of things getting very better. I recognise that we've got legal duties and we have to do commissioning. So you know, I'm not actually blaming the council on that, but yeah, feel a little bit disappointed. Thanks, Chair.
Thank you, Councillor Black. I wonder whether, but we can, or Shona, we can bring that into the realm of this item, please. Thank you.
So on Peterborough City Council, they are pursuing a separate commissioning strategy. So they are recommissioning a service as a result of this. We're just not doing it as a part of the same tender process, and there'll be two separate contracts in place. So depending on the outcome, it may not have a impact on the market in that area. From the ICB's perspective, there was a report submitted to one of their through their governance process, and we are just awaiting the outcome of that to receive confirmation of funding or not. So I can provide an update once we have that, but at this time I don't have the outcome of it. On consultation with the current provider, Guy, are you okay to do that?
Yeah, obviously with the current provider who's been providing it since 2019, we've got a strong working relationship with them, and we are fully engaged with them, and they have been engaged as part of this process. We mentioned the co-production. The co-production obviously included hearing the voice of provider, as well as people with lived experience and other professionals that might be involved in the overall system. So the voice that came was not just the voice of someone with lived experience. It was really broad. So the voice of the provider has been heard through the co-production piece, as well as through other mechanisms, and primarily through our contract management as well, where we meet with them very, very regularly. Yeah.
And it's probably worth noting that we soft market tested as part of this, and we've got quite a vibrant VCSE response as a result of it. So the sector has responded well. A lot of this won't come as a surprise when we issue the tender. So they're as prepared as they can be as part of that procurement process to engage in it.
Thank you. Any further comments on this item? Councillor Green.
Thank you, Chair. Yes, I just got a specific question about the cafe model that Councillor Bradnam mentioned. I think Councillor Bradnam said that it's been very successful, but the report also says it's going to be redesigned. So if you could just maybe let the committee know some details of the redesign and what that's addressing. And I've also got a second question as well. If I understand it correctly, that the report says there's 12 cafes a year. Is that 12 individual cafe events across the county? If it is, it seems a very, very small number. And I wondered if there's any way to increase that number. Thank you.
Yeah, on the cafe model, there are 12 locations which are delivered typically weekly. So during the life of the contract, it has obviously moved around slightly because it's based on need. And what we saw through the redesign is really around the equity across the county and ensuring that there is a minimum number of cafes per district, where there has been potentially an inequity where there's more delivered in one area and less in the other. So it's proportionate, making it more proportionate and equitable across the county. That's the significant redesign in terms of its structure. And we've taken the learnings from delivering them for the last 6-7 years and introduced that, and that will be reflected within the service specification, particularly around things like signposting, access, and obtaining feedback from people that use them, whilst maintaining an open access environment for them.
Thank you for the clarification. Thanks.
Any other comments, questions? Thank you, Shona. Thank you, Guy. We will move to the report recommendation. The committee is being asked to A, approve the commissioning of a mental health early intervention and prevention service from the 1st of September 2026 for a total period of 3 + 1 + 1 years at a maximum annual value of £943,462, giving a total contract value over the period of £4,717,310. Future uplifts are at the discretion of the Council and will be enacted through an annual uplift policy. And B, delegate authority for awarding and executing a contract for the provision of the service starting on 1st of September 2026 and subsequent extension periods to the Executive Director of Adults Health and Commissioning in consultation with the Chair and Vice Chair of the Adults Health Committee. We will move to a vote. Those in favor? I guess that's unanimous. The Democratic Services Officers will announce the result.
Yes, Chair, just to confirm that was unanimous.
Thank you. Item 6 is a report on the impact and consideration of legislative changes for the adult social care workforce. The report will be introduced by Chris Bush, Service Director of Strategy and Commissioning, and Sarah Bai, Head of Performance and Strategic Development.
Thank you, Chair. Morning again, everybody. So the paper in the pack concerned with this has been brought forward to committee today in response to a motion made at Council in October. It's here for information and to provide an update on two things, really, two related topics. So the first is to give a bit of an overview of the impacts as they are emerging from the changes introduced in the white paper, the Restoring Control Over the Immigration System white paper from May 2025. Most notably, but not limited to, the closing from July of last year of the social care visa route for foreign nationals, the impact that this is having on our local care workforce, and some of the approaches that we as a council are beginning to take to mitigate that impact. The other topic that this report considers, which Sarah will be introducing alongside me, thankfully for all concerned, is one of the key proposals that are being put forth about how to mitigate the implications, some of the potential impacts of that legislative change. And that is the introduction of a fair pay agreement for the adult social care market. Specifically, or primarily, should I say, designed to attract more workers not from overseas into our care markets nationally. So the paper sets out and addresses those two topics in broad form and as we understand them at the moment, and does so within the context which I will remind us all of our statutory duty as a local authority to ensure that we maintain a sustainable and appropriately skilled social care workforce that meets the needs of our residents as set out quite expansively in the Care Act, as I'm sure we all know. As well as setting out the implementation of these, the implementation of these reforms remain in progress, which they do at the moment. They are partway through. It also sets out some aspects of the reforms that are not yet implemented but will be. And these include things such as increases to skill and salary thresholds for worker sponsorship, the Migration Advisory Committee review, introduction of specific sector-specific workforce strategies. So the reason that I've outlined these, the reason that the paper outlines these forthcoming changes is to really highlight that whatever the impacts are that are currently being felt, they are likely to be far from the final set of impacts that will ultimately be felt. I think we're partway through this journey, not simply in Cambridgeshire, but nationally, in understanding what the implications of these legislative changes will be on the national social care workforce. We are starting to see some trends emerge as a result of these changes, as I've alluded to, and section 2.2 of the report sets those out in some detail. We are seeing, as would be expected, a significant decline of overseas nationals entering the social care workforce. That's in 2024-25. those numbers were approximately 50% lower than they were in the previous year. But we are currently also seeing declining numbers of UK nationals entering the care work recruitment pipeline. So that offsetting expectation is not currently manifesting at the moment, which does present a real challenge. And one of the key themes that continues to emerge nationally for this part of the social care workforce are issues relating to relatively unattractive paying conditions, which highlights the importance, particularly, of some of the discussions we've had previously at today's committee about elements such as the paying of the real living wage. There are, however, a vast array of steps that we are currently taking to try and mitigate some of the implications that are beginning to emerge. And I'm not going to list them expansively for committee today because they're all detailed in the report, and I'm sure you're all already had enough of listening to me speak. But a lot of work is happening locally in terms of the work that we're doing with our care provider market to help understand alongside them the implications of some of these changes as they're starting to manifest. And the report sets out some of the work that we're doing with them to support our care market to be able to meet some of those challenges and put in place some of the mitigations to some of the impacts that we're starting to feel, noting my comments about it is my view that we are far from in a position of having felt the full impact of this change at such an early stage in the legislative implementation cycle. We also set out some of the levers that we can pull as a local authority to start to influence the care market. And it goes back a little bit to some of the comments I was making earlier about things we can mandate and specify through our contractual mandating and things we can build into contracts. We can't necessarily change contracts that are in place at the moment to immediately do something about that, but we can start to shape new contractual arrangements at the appropriate moments for those parts of the sector when they come online to start to influence and incentivize domestic recruitment, or to alleviate some of the challenges we're seeing with the number of displaced workers that are extant in the system nationally at the moment. I think a big component of that will also be about the contract management and the provider management relationships that we have, because there is not going to be a one-size-fits-all approach to how we support our care market to respond to this. We're going to have to deal different elements and different parts of our care market will have different needs. The paper also summarises in 3.11, again, which I won't go into enormous amounts of detail here, that there's quite a lot of national activity going on as well. So there's national programs and national pieces of support and networks that are established that can be accessed both to support local authorities to help us navigate some of the challenges associated with these changes, but much more so to support the care market itself to be able to grapple with and adapt to some of those changes as they're brought forward. So I think in conclusion on that part, I think it's worth stressing for the committee today that we are not currently seeing increasing in concerns from providers regarding the delivery of care packages here and now. So we are not feeling particular stresses in the system at the moment, and it is not causing direct operational challenges. However, it is a threat to the stability of our care market, particularly during that transition period where we are seeing an outflow of one particular group of the part of the workforce not being replaced by a corollary input from another potential source of workers in that sector. Should that continue, and should that continue to materialise, I think we will move from a position where we're not seeing that challenge to the care market, where providers are starting to come and talk to us more seriously about sustainability issues and their capacity to be able to do what we are asking of them. I hope it would go without saying when I say that we will continue to monitor, and we are monitoring this very closely, and we will continue to do so. And I'm more than happy to provide updates through all and any channels as required on the progress and how this situation continues to unfold. I think, as I kind of said right at the beginning of this, there isn't only one, but there is one kind of significant and substantial pillar of the response to this nationally that is the hope of redressing that imbalance that's starting to be created. And that is about the establishment of a fair pay agreement, which is currently going through a phase of consultation at the moment nationally. So I will pause there because Sarah has joined me to outline that part of that part of the paper. So if it's okay with committee, I'll hand over to Sarah.
Thank you. I just wanted to provide a bit of an update. As Chris said, some of the response from government is to look at the introduction of a fair pay agreement, and this came from the Employment Rights Act 2025. The fair pay agreement is currently being consulted on and is only for adult social care, so it doesn't include children's social care at the moment. It's an agreement that will set minimum standards for pay and terms and conditions, and they'll be enforceable by law. And it can also through the consultation is asking whether it should also address sort of wider employment matters such as training and qualifications and career progression for adult social care workforce. Proposal is to set up an adult social care negotiating body, and that will be established to bring together trade unions and employer representatives to agree what those standards should be. The consultation is on a number of areas in terms of the implementation of a fair pay agreement and not the principle of a fair pay agreement. So they're consulting at the moment on how fair pay agreement should operate, including what should be covered, the remit of the negotiating body, what the process should be, how that should be represented, and some of the implementation and dispute processes that will be involved in that as well. The consultation closed on the 16th of January and the council submitted a response to that, having consulted with people within Chris's team in contracts, our finance, and also our internal colleagues in our human resources department, because at the moment the scope is suggesting that it includes local authority workforce as well as our provider markets as well. So we are awaiting the outcome of that consultation to understand what the implications might be. And we have, as I say, put forward the council's views on the negotiating body, the representation, to ensure that that represents the widest possible part of the provider market, and not just big providers, but also SMEs and people who pay for their own care and informal carers as well. I'll stop there because there's a number of different things within the paper, and happy to answer any questions.
Thank you very much, Sarah and Chris. Questions and comments, please. Anna Bradman, please.
Thank you, Chair, and thank you for the report. And I'm glad that you've got your antennae out with regard to this. So just from my own personal experience, as a councillor, but also personally, what I've observed in care provision locally is this loss of overseas staff and a concentration on local staff. I think that's been partly because the care providers locally have wished to engage local staff because they tend to be more stable, they tend to stay in the job. And indeed, what I observe is that local care homes do have a large proportion of local staff, but I observe that those staff are often approaching retirement. And this was also the case. My mother has sadly now died, but in the care home where she was elsewhere, this was in Suffolk, a lot of the care providers were actually older. And so there's going to be this loss of those local staff and a need to replace them. So absolutely, it's something we need to be aware of, because as you say, it hasn't impacted so much yet, because these are maybe care homes and providers with a relatively stable staff at the moment. But if people aren't encouraged to come in, then they will lose numbers over time. And as we know, care requires a big ratio of employees to service users. So I'm very glad that the government is looking at a fair pay agreement, and absolutely keen that it should in due course move to young people's care as well. The question I wanted to ask was, the consultation, did that, it seems bonkers to ask this question, but I assume it did include the care providers, did it as well? Not just us as a service, you know, as a contractor, because I can think of, off the top of my head, a lot of people who would have been very keen to contribute to that consultation. So they were consulted.
It was a public consultation,
Yeah,
so
good.
yeah,
Okay.
absolutely anybody could have provided a feedback to that.
Because what I've been aware of is a number of care providers who have felt obliged to take the situation into their own hand. And you remember when there was an opportunity to do sponsorship, you know, they did that. And because that was the only way they could get staff in, and at that time it was from abroad. And now that opportunity is being withdrawn, they're, you know, trying desperately to get staff in locally. So I think, I suppose it's not really a comment other than the one I've just asked, just to say I think this is really important that we engage. And the other thing is, we as a council are supporting the Care Academy, aren't we? To encourage young apprenticeships in the care services. And I think that's really good that we're supporting that. And I'd like us to link up and think about that support to an educational institution that's providing the appropriate training for people who might wish to go into care and who will then view it as a more professional qualification. So thank you, Chair.
Thank you, Councillor Bradnam. Councillor Fain.
That this is not, thank you, causing direct concern by providers yet, if I understood correctly. I'm surprised at that because I'm looking at, for instance, comments by the Care Association Alliance back in May when the effective ban on overseas recruitment was introduced. She said, we're potentially eliminating 50% of the population from our workforce, as well as making the sector less attractive. So there is widespread concern within the overall sector. And I just wondered, she also doubted whether the Fair Pay Agreement, this is Melanie Weatherby, who's I believe the Director General, I don't know her, not familiar with the sector, to be honest. And I just wondered how many within this sector are actually earning over 31,300 per annum, which appears to be the minimum level at which overseas recruits, including, of course, from elsewhere in the EU. I mentioned that because we also had a council motion on the single market and so on recently, but that's not for today. But you know, how many people in this sector can realistically expect to earn the sort of levels that would enable providers to recruit from overseas?
Thank you. So I'll work slightly backwards on that one because the answer to the second question is off the top of my head, I don't know, but I would be pleased to go away and furnish the committee with the details of that. Apologies for not knowing. I think on the first point, from talking to providers and from looking at the data and talking to my colleagues kind of nationally, I think the sector finds itself almost at the precipice. So I don't think we're quite there in these impacts yet being felt, but kind of lots of the modelling that's being done says it's about to come. So for example, kind of regionally, we're looking at a shortage of somewhere in the region of 30,000 jobs in this sector being where the sector will struggle to fill those roles as things stand at the moment if everything remains unchanged. So I think that it's reasonable to deduce from that it's coming. Some of the legislative changes put in place a number of kind of short-term safeguards and transitional arrangements that is in the short term mitigating some of the impacts, but those short-term arrangements are also going to run out, hence my use of the word precipice, which is maybe slightly dramatic, but certainly on the edge of a bit of a shift here. I think the other piece is the comments that have been made already about the profile of the workforce, where we've got an aging workforce, and we see that nationally, we see that within care homes. You tend to get greater stability at that point, but then what you see is a significant departure from the workforce as people retire, and the pipeline and the concern, quite understandably so, is the pipeline is not in place to replace those workers that have moved on from the sector, and that would be twofold for two broad reasons, or lots of smaller reasons that coalesce behind it. One, which was touched on a moment ago in observations made, was about getting the pathways right, and how are we positioning, how are we supporting the care sector, and how are we as a council kind of championing the care sector as a legitimate career pathway, and how are we making those connections between education and skills development into connectivity with work going forwards. But equally, the challenge that runs alongside that is, in order for that, one of the things that makes that an attractive career pathway is about the feasibility and the viability of that as a career. And fundamentally, that will often come down to, it needs to pay a wage upon which people are capable of living. And if it doesn't, no matter how attractive a career it might be, that will be a limiting factor. And I do agree with the comments that have been made. We are placing a lot of stock in the impact that the Fair Pay Agreement may have. On paper and in principle, it makes complete sense, and I personally am completely supportive of that in its role in stabilising the workforce in the care sector and building its attractiveness for people to go into it as a career. How that will play out and what it will look like, I think we're all waiting to see what the reality of that will be. So I would expect that where providers are currently saying we've kind of got this, we're holding it at the minute, that if everything remains as it is unchanged, which hopefully it won't, we are likely, very likely in my opinion, to see those providers starting to come to us and say, hang on, we've got a bit of a problem now. Now, hopefully the mitigations that are coming forth get there in time to prevent that, but we are somewhat playing a bit of a waiting game about other developments as they come over the hill. Sorry, a bit of an ongoing answer there, Councillor.
Councillor Friend, you want to come back there?
If I may just pick up, I think Chris just said, if everything remains the same, which hopefully it won't. I'm just not sure that I see much that is coming forward that is likely to make a substantial difference. That includes the FPA, but it's not a sector for which I'm particularly familiar, so I may have missed significant coming developments.
Not at all. Healthy skepticism is always good, and this is an area of business where we've seen lots of endeavours to make changes that haven't necessarily always materialised. So I think, you know, we maintain a healthy reality about A, what might come forward, and B, what impact those things that come forward might be. And as I said, I mean, I share some of those sentiments. I think a fair pay agreement that one may reasonably consider to be a fair pay, and I think we may all have slightly different definitions of that, but there'll be a threshold that all of us say it's above that, is going to be crucial to this. We know that in many cases, but not all cases, one of the things that I repeatedly hear, less so in Cambridgeshire since I've arrived, because I've only started to have these conversations, but certainly over the course of the past decade of my career, have been care market saying to me, one of the biggest challenges we've got is this is a very difficult job, and it is a very difficult job. And the people that we are seeking to recruit can earn more sitting on the checkouts at Audi than they can doing these jobs. And so and that is cited often as a primary, not an only, but a primary reason why people are not able to maybe join the care sector even when they want to. So you're right, we are putting a lot of stock in this, and I think we have to wait and see how it plays out and then rethink once we've seen the outcomes of it, would be my view, which may will almost certainly necessitate more discussions of this type as we try and not only navigate this as a local authority and decide how we best might want to approach this, but nationally there will be the conversations that will suddenly kick off once we can understand the edges of this. So was a long way of saying I completely agree. There are many challenges ahead that may or may not, mitigations that may or may not meet those challenges.
Thank you, Chris. Councillor Black.
Thank you very much, Chair, and thanks very much for this report. This is all very useful. I'd actually have quite valued it if you had gone through the things we have at point 3.10 of the report on page 88 of the things the county is already doing for the care workforce, things that over the last 4 years we've brought things in, and I think we've especially got to talk about the Care Academy, and of course we have made a start on the well, we are doing the real living wage thing. But when we're looking at a better deal for care workers, it's got to go beyond just wages. It's got to look at all the terms and conditions. And at the moment, the care workforce is stuck in a position where the employers are fragmented, where they very rarely have trade unions that are properly recognised and talked to and have a role, where the staff are not really listened to. We need our social care for workforce to be valued so much more than it is now, because at the moment they seem very much at the bottom of the pile. When you look at the value that's put on certain sorts of work, like say if you're a director of this land or whatever, you think, well, you know, where is the equity? But let's concentrate on the care force. The care force is very much, I feel, downtrodden, and it is good that the government is looking to try and move that, because that is where we really need to make the changes. We have to look at the proportion of foreign care workers in that workforce. It is driven to some extent by employers who feel that they can get away with worse terms and conditions for foreign care workers. We've also had problems where we have had, for instance, domiciliary care workers, where the whole modus operandi of the business is to recruit only from overseas. And I think, you know, there are council officials who have felt that this hasn't led to ones that have served us very well. And I certainly think as well there is also real problems with people adhering to the law and correctly recruiting from overseas and doing what's right. And I think we've probably got a problem of people who are working but are not really being treated as workers as well. We do have a crisis at the moment, I think, and you know, it is in the 2 and a bit years I've been on the council, we have had horrific failures in service delivery and sometimes in the company continuing to exist with our care companies. And even now we've got situations where the care company should have a certificate of sponsorship that can be investigated. It can be taken away from companies. Companies can go bust. So, you know, I've been asked questions about Enlightenment Care of Arundel, which I think no longer exists, Lav Care Limited, which I'm not sure if we still place people with, MF Healthcare. And so we have to consider that now we have people who are under investigation or possibly ceasing to exist. We have some people who will have been in breach of the sort of things that they have to keep doing to retain their certificate of sponsorship. You have to wonder, when one of these companies loses its certificate of sponsorship, whether it will be able to continue to meet its obligations. But I just want to conclude on the progress that we're making. It is important that we increase the terms and conditions and the pay especially, but not only the pay of care workers. The other leg of these policies has to some extent been driven by public demand rather than by thought within people who are having to actually deliver care. And in particular, we have some newspapers that shape public demand who seem more concerned that they would like to see pain and bad things happen to people who they treat as the other, as as foreign, as they like to see bad things happen. They're keener on that than actually to see the good things happen, to actually improve the terms and conditions for care workers, whether whatever their background. But we will have to monitor this. I think the government needs to consider whether the policies it is doing to assuage popular opinion, whether there is any rational basis behind that, and whether it is causing problems so severe that they will need to consider exactly what way they are going forward. But on the issue of improving the way that care workers are valued, improving their pay, improving all their terms and conditions, improving their career paths, and making it a real profession, that is part of the way out of the problems that we have in social care, and we must welcome that. Thank you.
Thank you, Councillor Black. Councillor Howitt.
Thank you, Chair. Firstly, just to acknowledge that the council resolution referred to is from my colleague, Councillor Boulat, so good for her, but then supported by the full council. I'm very glad that the Chair and Vice Chair of this committee ensured that this report came on the agenda. It is an issue of high importance. Thank you to Councillor Bradnam for what she said, welcoming the fair pay agreement. It's not for the officers to welcome or not welcome what the government does, but come on, folks, the Labour government has done a good thing here. It's going to increase the pay of care workers who are underpaid, and they're going to be more secure in their jobs because of it. And the government is giving extra money to fund it. I know we haven't seen all the detail yet and all the rest of it, but as politicians, we should be welcoming it. This is a good thing and something that many of us have been calling for a long time. So let's not be merely mouthed about that. I was interested to hear that the council has responded to the consultation on the fair pay agreement. I don't think that can be private and confidential, so I hope that reply can be shared with either myself or with all members, because obviously it's been made in our name, so it'd be interesting to see what the council has actually said in relation to that. And like my colleague Councillor Black, I hope that our position as a council is one that supports a broad role for the future body, negotiating body, which includes training, which includes terms and conditions, which includes career development opportunities in the same way we've tried through the Care Academy, and I'll come back to that in a moment. Then we come on to the migrant international workers issue, and I also pay credit to my colleague Councillor Black, who brought forward a different council resolution on this, which sadly Lib Dem colleagues chose not to support. And I said at the time, I don't really believe that you think treating international workers unfairly is a good thing. I think you got it wrong that day by not supporting that resolution. And what we should recognise is that fair treatment of international workers is a problem. There are abuses out there of how these workers are being treated. And I believe we have a duty to ensure in Cambridgeshire on our watch that those abuses aren't happening, and if they are, to deal with them. And that's what that previous resolution was trying to do. And I appeal to the Lib Dems, just accept on that occasion you made a decision for political reasons or whatever. But this report could have been an opportunity to address that issue and to come forward with some recommendations to do so. And I still believe that should be the case. And the report talks about charges to care providers and employers for the international workers they employ. But there's lots of reports that migrant or international workers themselves are being charged for the privilege of doing a low-paid job. And that's an abuse. That shouldn't be happening. And they should get those fees returned where they exist. And we as a council should be dealing with that. And so it was disappointing. I think there's a real missed opportunity in this report to look at the issue. And finally, on the Care Academy, I really try hard not to look backwards and say when Labour was in the administration it was better, right? Because it's an easy thing. So I really try hard. But in the previous administration, we championed the Care Academy. We championed that we were paying people more, and treating them more fairly. And I remember the previous assistant director saying it was working. The turnover rates were going down, that vacancy rates were going down. Some of the figures in this report question that, by the way, and it would be interesting to understand what's going on. But and I remember Councillor Slatter, the Lib Dem former colleague, she was a champion of this as well. So it wasn't just Labour that was pushing this. And I don't see the new administration championing this in the same way. And I think if it was, we would see a very different report here. And when I look at paragraph 3.10, I think it is, let me just make sure I'm quoting that correctly. When I look at paragraph 3.10, with greatest respect to the officers, there's nothing in here you're doing new other than watching and listening and talking to some people. There's nothing here that's going to say that some action will be done to make workers further better off, develop the care academy further, root out the abuses. It's all about attending more meetings and keeping an eye on things and being prepared to report back. And I think we could be more ambitious than that. And this report is a missed opportunity. And so I appeal to the new administration and to the officers, please look again at this policy area. Think about where we positioned ourselves in the previous administration and think about taking a more ambitious stance on what we as a council can do.
Thank you, Councillor Hewitt. I wonder whether immigration enforcement is one of our issues, but Patrick, would you like to comment on that particular topic and the others that Councillor Hewitt mentioned? I might have a few comments as well.
So we work with the necessary immigration arrangements, and when they suspend, we've got people providing care, usually providing care and support in. We've occasions where there are providers registered in Cambridgeshire that have suspensions, and we don't have anybody placed with them because that's the nature of the frameworks that we operate. So what we do is we have a regular tracker around providers of concern, and that's not just about employment of international workers, that's others, and we keep an oversight of those. And actually at the moment we've got probably the lowest numbers of providers of concern on our books. Some of those providers do have suspensions around their international recruitment approaches and some of their procedures that they're not doing. What we do is we make sure that the care continues to be provided by the people that they're employing, and we make sure through the necessary checks that those risks are minimised so that we continue to ensure that care and support is provided. But in terms of our oversight and scrutiny, that comes from our safeguarding responsibility, that comes from our work with our providers, that comes from our work with our partners, be it the NHS or be it voluntary sector or police, who we work closely with around potential implications around modern day slavery. So we continue to have an oversight and a check on those. We don't have anything directly around the immigration aspects. That's dealt with through the Home Office and other procedures, but we certainly, as a key partner, we pay close observation and work closely with them on that.
Thank you, Patrick. Of course, everybody welcomes a fair pay agreement on this, but we have to be very careful that the staging of all these measures seems incoherent, to say the least. On the FPA, if the wage floors they ratchet wage increases without fully funded uplift, commissioners like Cambridge and County Council will face a double bind. So that is a statutory duties against unsustainable fees. And we are not invited at the table when these things are set up, and we are not in control of that. So that is an unknown and a difficult thing that at this moment we can only speculate about. On the visas, I read the letter from the Minister for Migration and Citizenship, where he addressed the issues of abuse. However, Cambridgeshire is in areas of our county, unemployment is very low, and competition for skilled workforce is very high. Ending visas now and fixing the workforce later is, in my opinion, a very risky approach, particularly in the care sector. So even with the 500 million that is being provided in the meantime, that only equates to a 20p per hour if we spread that across. Again, that is both a timing and a quantum problem, in my opinion. So those are the considerations that we have no option but to endure, and that probably is the right word. Any further comments or questions? We have one more item in the agenda. Let me go back to my, and we might finish the meeting early. So no more questions. We will move to the report recommendations. The committee is being asked to A, note the impact arising from the recent cessation of international recruitment into the adult social care workforce, and B, to note the ongoing consultation on a fair pay agreement proposed by the government for adult social care, which is seen as a key mitigation nationally to facilitate the recruitment of British nationals into roles previously held by overseas workers. No vote is required. The final item of business is item 7, the committee's agenda plan, training plan, and committee appointments. This can be found on pages 93 to 100 of the agenda pack. Would Democratic Services Office let us know of any changes to the committee agenda plan since publication?
No changes, Chair.
Okay. Are there any questions or comments from committee members on the agenda plan? Councillor Howard.
I just note again that yourself and Councillor Wilson are deliberating on the report on insourcing. I think we've been told that 2 successive committees. This is the 3rd one. I know that you take your duties extremely seriously, so you're deliberating very hard, but I hope that you will reach a conclusion on your deliberations as soon as possible.
Thank you, Councillor. We will. Next is the committee training plan. We reviewed these at the spokes last week and agreed to schedule 2 sessions to align better with the committee work program. The Democratic Services Office will report these changes.
Thank you, Chair. Yes, there's a session scheduled for the 28th of January on Cambridgeshire's care market. That will move to the 18th of March. And secondly, a session on joint commissioning with health partners and Section 75 arrangements. That will move from the 18th of March to the 25th of March, and updated invites will be sent for those.
Are there any questions or comments on the committee training plan? Finally, we have committee appointments. There are no changes to report this month. So that brings us to the end of today's business. The committee will meet next on the 5th of March. I declare the meeting closed. Thank you.